Good evening. There will be a different set of conditions depending on someone's vaccination status.
Measures around testing, outbreaks, and isolation that could affect millions of us in the months ahead. We begin with CTV's Queens Park Bureau Chief Colin DeMello. Colin.
Well, Nathan, this could be the province's way of convincing the final few to go into a vaccination site and roll up their sleeve. The province says if you are unvaccinated and you're exposed to the virus, you will have to isolate for 10 days, even if you are asymptomatic. Cases of COVID-19 may be on the rise, but health experts say the fourth wave will be very different.
This will be a pandemic of the unvaccinated now.
According to new provincial guidance, unvaccinated people will be treated differently if they are exposed to the virus. Those who are unvaccinated would have to isolate for a minimum of 10 days and require 2 negative COVID-19 tests 7 days apart. But fully vaccinated Ontarians would face a different set of rules. If you are exposed but asymptomatic, you would only have to monitor your symptoms for 10 days and would not be required to get a test. Symptomatic individuals would have to self-isolate for 10 days if they are COVID positive, but can leave home after 24 to 48 hours if they are negative. Health experts say the vaccine is ultimately what makes the difference.
If you are vaccinated, you pick up COVID, you are less likely to transmit it to somebody who isn't vaccinated. And one of the reasons is that the people who have been vaccinated, the period in which they're infective and can transmit virus is generally going to be shorter.
Those isolation rules are also going to apply to students and educators, but with a little nuance. If a student tests positive, for example, the entire cohort, regardless of where they sit, will be considered a high-risk contact. While symptomatic contacts would need to be tested, students who are vaccinated and asymptomatic can return to school almost immediately. But if students in a cohort are largely unvaccinated, they would have to isolate for 10 days and be tested for the virus, leaving thousands of students under the age of 12 at risk.
We need to try to keep schools as safe as we can, also for those below the age of 12 who didn't have an opportunity to get vaccinated, meaning all the parents should get vaccinated, all the school staff should get vaccinated.
Some in the medical community say the province needs to clarify whether vaccines will be mandatory for frontline workers.
As we do continue to see case counts rise, it will be vital for Dr. Moore and the province to make very clear an overall provincial vaccine policy. There may be certain settings that are more amenable to requiring or to having vaccinations as part of the foundation, and certainly school settings are one that are being discussed.
The Ford government has so far rejected the idea of mandatory vaccinations. So what happens in an elementary school? Well, the province says those under the age of 12 who are not eligible for the vaccine will fall under the unvaccinated category. That means if a student tests positive, the entire cohort would be sent home and would have to isolate for a minimum of 10 days. In middle schools and in high schools where there is more vaccine coverage, the province says it would be an exceptionally low case or a percent or chance that the entire school would have to be closed in the event of an outbreak. Reporting live, I'm Colin DeMello. Now back to you.
All right.